Dr. Natalie Marks with a quick cup of knowledge. I'm joined today by Dr. Kevin Stepaniuk. He is the owner of Pacific Veterinary Dentistry and Oral Surgery Services. Thank you so much for joining us.
Thank you.
So, veterinary dentistry has really gained a lot of momentum, I feel like, in the last 10, 15 years.
Okay.
And we're really excited to talk today about how we can take that knowledge and market it and develop it in small animal practice.
Okay.
So one of the things that a lot of our colleagues tend to find is maybe a young veterinarian comes to one of these conferences and they hear about getting dental radiography in their practice, but maybe their manager or owner isn't as thrilled. What are some strategies or some key points you can give to them, the marketability of that in practice and the need?
So the first thing is as I recommend to veterinarians that they're in that scenario, that they have to kind of approach it from multiple facets. Because different things are going to motivate different people, whether it's good or bad. So talking to your owners and your management about the fact that you will be helping the pets by identifying more disease, alleviating the pain and suffering, you're helping your clients will be satisfied. And with that, by finding more disease and actually treating more disease, it will actually become a profit center in your hospital. The next thing is that you can actually do the numbers pretty quickly. So for example, I talk to veterinarians and I'll say, well, how many doctors in your practice? And I'll say, well, we have 2 or 3. And I'll say, well, how many dental procedures do you do a week? And they say, oh, we do about, say, 2 to 3 a day. So I says, let's just do 2 a day. And so if you do 2 a day and you just say charge $100 for dental x-rays, and this doesn't even include the additional pathology, that's $200 a day times five days, that's $1,000 a week, so that's $4,000 a week, so 4 weeks times $4,000 is $16,000, and just by doing that alone, and not even identifying the disease, you have actually paid for your dental radiology equipment. So it can be truly a win-win. And I think some practice owners and managers, when they actually simplify that math, the aha moment comes on, the light bulb goes on.
Yeah, absolutely. And I'd love to hear some of the strategies that you use, and you don't have to tell us all your secrets, but how you really market that to your clients, because they really have to see the value in what you're doing, right?
So you have to start with the same message from front to back. All the doctors have to be on board, all the staff has to be on board, and you need to start talking about dentistry in every single appointment. You need to talk about dentistry and preventative care when they're younger. You need to start talking about when you're talking to clients for their annual wellness exams, or they're there for their exams and their heartworm test, that the AHA guidelines, the dental guidelines, suggest that the first dental cleaning should be 1 to 2 years of life, and then annually thereafter. You need to start talking about doing preventative care so that you don't have serious disease later in life with a patient that has concurrent illnesses. And so it's a matter of actually speaking about dentistry in all of those appointments. If the whole hospital doesn't buy into it, only one doctor is promoting dentistry and talking about it, it's going to be harder to increase that service in your hospital. So everybody has to believe it and talk about it. So
yeah, I think that's a great point.
Yeah.
And also on that note of involving the whole team, isn't this an area really where the veterinary technicians of the practice can really sort of elevate themselves and become more empowered to be part of the radiographic process and probing? As I think in some practices they might feel a bit stifled, but this is really an area where it's got to be a team approach.
So absolutely. So first of all, I can't do anything I can do without my technicians, so I'm going to acknowledge that right now. If I don't have my technicians helping me with anesthesia and helping me with my surgeries, I'm lost. I'm a listing ship in an ocean. I need them. So absolutely. So dentistry, a lot of us and my colleagues talk about the team approach, because the one thing that has been a challenge for general practice dentistry for many years, even for me 20 years ago, is I think that dentistry is done in too much of a linear fashion. Either they send one technician in the back to do anesthesia and then clean the teeth and then maybe take x-rays and then maybe have the doctor look at them and then maybe then extract teeth. It just makes the procedure so long. So the technician needs to be back there with the doctor, and you need to be working in, I call, more parallel approach where yes, you're back there with the technician, the patient's anesthetized, the technicians clean the teeth, they get the x-rays for you, You're looking at the x-rays, making your diagnosis while they're finishing cleaning the teeth. You're getting the nerve blocks on board, whether it's a tech or you. You've made your diagnosis. You've called the owner during the procedure and say, hey, Mrs. Smith, remember I was going to call you after we did our examination. I did find those teeth we talked about need to come out. By the way, I found these 3 additional teeth. So you're on the phone as the doctor providing value to the client. Then the technician can move aside, you extract the teeth, and then it really does need to be a team approach. And then the technicians are really valuable too, because the other part of dentistry that I think sometimes is for value services is a lot of veterinarians may still clean the teeth, extract teeth, and then they stop there. And what they're forgetting is that you need to talk about prevention. And so when they come back for their recheck in 2 weeks or 10 days or whatever, and you're like, okay, well, the extraction sites have healed, now we got to talk about preventative care. So that's when the technicians can come in and they can talk about how to do toothbrushing. What are some other, if you can't toothbrush, what are some other alternative products like VOHC's, Veterinary Oral Health Council products that they can use to help prevent the return of the plaque and the inflammation, what chew toys to avoid. And so the technicians can really, you can almost have like a technician, I'm trying to think, this was not my word, but I saw someone mentioned, I think on a dental forum, a concierge. You have a technician that really is spending a lot of time communicating with those clients, because the thing about dentistry is not only is important for the pet and the health of the pet, is that it's a continued process throughout life.
Absolutely, and client retention is,
Yeah.
of course, invaluable
Yep.
in practice to the success of a business.
Yeah.
On that note, though, I think one challenge a lot of, including myself, practitioners have is you look at a mouth in an exam and think one thing, and then once you get that dog or cat under anesthesia and have cleaned the teeth and taken your dental radiography, all of a sudden what looked like nothing now turns into 20 extractions.
Yep.
How do you successfully offer treatment plans or market that from a financial perspective so there aren't surprises to clients, or that they don't think, well, it could be $800 to $4,000 and I need help in between?
So I was in general practice dentistry first for a few years before I became a specialist, and I've been in the dentistry world for like 15 years. I think our entire profession has to have a collective paradigm shift. And I say that, and I'm not saying that lightly, because more people are doing x-rays now, which is awesome. And that scenario is, that question, that scenario I hear everywhere I go. So here's the paradigm shift that I think that our profession needs to start thinking about, is we need to start maybe thinking about scheduling a procedure for a cleaning, an examination, taking our x-rays, and schedule your time block for an hour or whatever it is going to be for the dog. You guys decide, plus or minus. Clients are aware that this is just the cleaning, the exam, and then the x-rays. You obtain the x-rays, and if it's pretty straightforward and maybe it's one tooth, you call them and you take care of it. But if it's going to be extensive, you've already set them up to the fact that this is just a diagnostic procedure. Once we get the x-rays, your pet's going to wake up, and we're going to review those x-rays, and we're going to develop a treatment plan that we maybe will follow up down the road, maybe in 2 weeks or 3 weeks. We'll give you a better idea of cost estimates, because maybe you can afford the whatever it is, 3, 4, 5, 6, whatever the price is, the cleaning and exam and x-rays, but you're not prepared for $2,000 worth of oral surgery. And again, most dentistry is not it's a chronic problem. Unfortunately, it's generally not an emergency. So you can identify those teeth and then review the x-rays with the clients, which are literally black and white, and you can show them where the bone loss is. They see that. You can make a more accurate treatment plan, and then they can come back for a second procedure down the road. And I think we have to have a paradigm shift and start approaching dentistry like that, like they do on the human side, in order to accommodate the patients and these common scenarios. The question that arises, which is going to be asked, is, well, is it going to cost me more? What about all the additional anesthesia? Well, that's when we talk to our anesthesiologist friends, just like, are you better to have 2 shorter anesthetic episodes that are controlled, rather than one really long one that's going to be hours in a marathon in duration, and then you're pushing your whole day, and plus that patient's under anesthesia, is more likely to get hypothermic and have more potential complications after a certain duration of anesthesia. And so I say, tell your clients that, you know what, we're going to have 2 shorter anesthetics. We have a plan, we'll go in, but it's going to cost a lot more. Well, not necessarily, because if we have to extract these teeth, the amount of anesthesia we would charge today to extract the teeth is going to be the same duration of anesthesia that we plan for and charge in 3 weeks or 4 weeks or 2 weeks. and the surgery time required is still going to be the same whether we do it today in 3 or 4 weeks. But we're going to have Fluffy have 2 shorter anesthetics than 1 marathon anesthetic. Kind of a thought process.
I'm fascinated by it, and I think a lot of people probably listening are going to be going, wow, that sounds a lot better in many aspects of your day. So I hope that there's more conversation about that. We're out of time, but thank you so much for all of your thoughts, and have a great rest of the conference.
Thank you.